Hi, how are you doing today?
Good, yourself?
Good. What's your name?
Justin.
Justin. I'm Dr. Catherine. I'm going to be performing an evaluation of your spine today from about the base of your head down to your belt line. In fact, to expose any skin in that area. Is that okay with you?
Yes.
All right. I'm going to go ahead and check this table. All right. And then go ahead and remove your shirt for me.
Okay.
And then have a seat facing that wall.
This way?
Yes. My segmental contact point for the SI joints was medial PSIS, and then the lumbar and thoracic spine, it was midline spinous processes. And then in the cervical spine, C7, C2, I was on the articular pillars, and then C1 on the lateral masks.
What was your line of drive?
My line of drive in the SI joints was lateral to medial, P to A, and then in the lumbar, posterior to anterior. In the thoracics, I was P to A, I to S, and then I transitioned P to A, S to I. And in the cervicals, I was P to A, S to I, and then I transitioned P to A, I to S as I moved up the cervical spine.
What was your end feel?
I was feeling for a spongy infield.
Did you have any restrictions?
I did not.
Go ahead.
All right, Justin, if you would have a seat back up on the table for me. Let me face this wall. All right, cross your arms and your chest. All right, move forward.
What was your segmental contact point?
My segmental contact point was the L23 junction, and during flexion it was the interspinous spaces, and the sides of the spinous processes in rotation and lateral bending.
Line of drive?
My line of drive was lateral to medial for both right and left rotation and lateral bending.
End play?
For in play and flexion, I was feeling for separation of the spinous processes. And then in rotation and lateral bending, I was feeling for L2 to separate in reference to L3. And as I drive and spring through the joint, I was feeling for a spongy infield.
Were there any restrictions?
There were not any restrictions. All right, if you would go ahead and lay on your stomach for me.
What was your segmental contact point?
My segmental contact point was the joint cleft in between the PSIS and the sacrum.
And your line of drive?
My line of drive for flexion, I contacted the right ASIS and pulled anterior to posterior on flexion, and then on extension, the leg pull, and I was checking anterior to posterior.
Okay, and your end play for flexion?
On flexion, I was checking for posterior glide of the PSIS relative to the sacrum, and then for extension, I was checking for anterior glide of the PSIS relative to the sacrum.
And did you feel any restrictions?
I did not. Back for me real fast. All right, you can move them. All right, go ahead and cross your arms. Go ahead.
Okay, what was your segmental contact point?
My segmental contact point was the T8T9 junction, and then for flexion and extension, it was the interspinous spaces, and for rotation and lateral bending, it was the side of the spinous processes.
Ribs.
For the ribs, it was the inferior angle of rib 8 in elevation, and in depression, it was the superior angle of rib 8.
Line of drive.
Line of drive was lateral and medial for both right and left rotation and lateral bending. And then for the ribs and elevation, my line of drive was I to S, and then for depression, it was S to I.
And your end play.
My end play for flexion and extension was for the spinous processes to separate and close, and then for lateral rotation and rotation and lateral bending, it was for movement of T8 relative to T9 and to feel for spongy infield. And then for the ribs, also feeling for spongy infield.
Did you feel any restrictions?
I did not.